It starts as a little inconvenience. Maybe it's a small leak when you laugh or sneeze. Perhaps you notice you're rushing to the bathroom more often than before. Or you feel embarrassed when you can't control your bladder in public, so you start limiting your outings or stop drinking water before leaving the house. If this sounds familiar, you are not alone. In fact, over 50% of women and nearly 30% of men over the age of 65 in the United States suffer from some form of urinary incontinence. That's not a small number. It's millions of people just like you. But sadly, only a tiny fraction of them ever talk about it or seek help. Why? Because of shame, because of fear, because they believe it's just a normal part of aging. But what if I told you that science shows it's not something you simply have to accept? What if I told you that ignoring this problem could lead to falls, infections, depression, and even early death? Let that sink in for a moment. Urinary incontinence isn't just a bathroom issue, it's a life quality issue. It affects your sleep, your confidence, your social life, and even your safety. But here's the good news, it's treatable. With the right knowledge and support, you can reclaim your control, your dignity, and your freedom. And this video is going to show you exactly how. Backed by the latest medical research, practical solutions, and real-life strategies that doctors use every single day, we'll walk through everything you need to know, step by step. But here's the catch. If you don't watch till the end, you might miss the exact tip that would have helped your specific condition. And that means you might walk away without a solution and continue living with the same struggle. So do yourself a favor. Stay with me to the end, because this isn't just another health video. This one is for you. Let's start with something you may not realize, the real reason why incontinence starts. You see, not all leakage is created equal. For example, take Joan, a 72-year-old retired teacher from Sacramento. Joan began experiencing bladder leaks whenever she picked up her grandkids or walked upstairs. She thought it was weak muscles, but she didn't know her bladder had actually shifted position slightly after menopause, something called pelvic organ prolapse. Her doctor diagnosed stress incontinence, one of the most common forms where pressure from movement pushes urine out. In fact, this is extremely common in older adults, especially women, due to weakened pelvic floor muscles after childbirth and aging. The good news? Joan learned simple pelvic floor exercises called Kegels, combined with a bladder training schedule, and she saw results in just 3 weeks. The better news? This approach works for thousands of people, but most never try it because they don't know what's happening inside their own body. So let me ask you, have you ever noticed when your leakage happens? Is it when you laugh, lift, or cough? If so, it might be stress incontinence, and the solution could be far easier than you thought. Have you ever tried pelvic floor exercises before? Share your answer in the comments. We're here to support one another. Another type of incontinence that affects many seniors is called urge incontinence, and it can be far more disruptive. This is when you feel a sudden, overwhelming need to urinate and you can't get to the toilet in time. It can happen day or night and often leads to people isolating themselves or sleeping poorly. According to the CDC, urge incontinence is one of the leading reasons older adults are admitted into long-term care, not because of the incontinence itself, but because of the falls and injuries that result from rushing to the bathroom. The bladder muscles in urge incontinence contract involuntarily, creating that intense urgency even if your bladder isn't full. This is sometimes caused by nerve damage, such as from diabetes, stroke, or Parkinson's disease. Or it can happen without any obvious cause. But did you know that there are medications, bladder retraining techniques, and even nerve stimulation devices that have helped many seniors take back control? Doctors may prescribe anticholinergic medications or even beta-3 agonists to help calm the bladder muscle. But medications aren't always the first choice. Lifestyle changes, avoiding bladder irritants like caffeine and alcohol, and learning timing techniques can be life-changing. What has worked for you so far, if anything? And what do you wish someone had told you about your bladder sooner? If this video has helped you so far, please type yes in the comment section. If not, type no. This will help us create more valuable health content that meets your exact needs. Some older adults experience what is called overflow incontinence. This is when your bladder doesn't empty completely and continues to fill up until it leaks, drop by drop. It's a condition that's more common in older men, especially those with enlarged prostates or conditions like diabetic neuropathy. In this type, you may not even feel the urge to go, but still find wetness in your underwear or on the bed. Some report a weak stream of urine, or a feeling that they can't empty all the way. It can be very frustrating and even dangerous. Why? Because if urine stays in the bladder too long, it can lead to urinary tract infections or damage to the kidneys. The solution depends on the cause. For men with prostate issues, medications like tamsulosin or finasteride may be prescribed to help the urine flow better. In severe cases, a catheter may be needed temporarily. If nerves are involved, bladder scans and urodynamic testing can help guide the next steps. Have you ever experienced frequent infections or difficulty starting urination? If yes, don't ignore those signs. They may be pointing to overflow incontinence. Have you ever had a bladder scan or a prostate check lately? Another concern we need to talk about is functional incontinence. This one often goes undetected because it's not about the bladder. It's about your environment or physical limitations. Let me explain. Imagine you feel the urge to urinate, but you walk with a cane and the bathroom is on the other side of the house. Or maybe arthritis in your hands makes it hard to pull down your pants in time. You know you have to go, but by the time you get there, it's too late. That's functional incontinence. It's heartbreaking because the bladder itself is working fine, but something in your daily routine or physical ability is preventing timely access to the toilet. This is common in seniors with Parkinson's disease, arthritis, poor vision, or mobility challenges. It's also common in homes that don't have grab bars, night lights, or a clear path to the bathroom. In this case, the solution may not involve medication at all. It may involve home safety changes, physical therapy, or even setting a timer to remind yourself to go every 2 hours. You'd be amazed at how life-changing those simple changes can be. Have you ever missed the bathroom just because it took too long to get there? What's one thing you wish your home had that could help? Let's not forget mixed incontinence, which is a combination of stress and urge incontinence. Many older adults, especially women, experience both types at different times. You might leak when you laugh and also feel sudden urgency at night. This is very common and often harder to treat because it requires a combination of therapies. But don't let that discourage you. A 2022 study from the University of Michigan showed that combining pelvic floor physical therapy with bladder retraining and timed voiding led to a 60% improvement in symptoms over 6 weeks in adults over 65. That's real progress. And the best part, these methods are non-invasive and can be started from home with minimal cost. If you're dealing with both stress and urge symptoms, you are not alone. Have you ever experienced both types of leakage? How do you tell the difference? Now let's talk briefly about something most people don't realize: the role of medications in causing or worsening incontinence. Yes, some of the pills you're taking right now might be making things worse. For instance, diuretics, commonly known as water pills for high blood pressure, can increase urine production and urgency. Sedatives or muscle relaxants can reduce your awareness of bladder signals. And certain antidepressants can interfere with bladder contractions. Even over-the-counter cold medicines with decongestants can tighten bladder muscles and make it harder to empty fully. If your incontinence started after beginning a new medication, it's worth reviewing it with your doctor. Don't ever stop a medication on your own, but bring it up during your next visit. Say something like, "I've noticed my bladder issues started around the same time I began this medicine. Could they be related?" This simple question could lead to a safer, more comfortable life. Have you ever noticed your symptoms got worse after starting a new pill? Here's a powerful truth. Incontinence is not a character flaw. It's not a punishment for aging. It's a medical condition that deserves treatment, respect, and compassion. And yet, thousands of older adults suffer silently, hiding their pads, skipping family events, and losing sleep over a problem that could be improved or resolved. Why does this still happen in 2025? Because we don't talk about it enough. But we're going to change that. Right here, right now, this community is your safe space, a place where you don't have to feel embarrassed, where your comments help others. So I ask you, what's been the hardest part of dealing with incontinence for you personally? The emotional toll, the practical inconvenience, the fear of accidents in public. Share your experience in the comments. Your voice matters more than you know. If you're finding value in this, now is the perfect time to click the like button and leave a comment with your thoughts. It's not just about helping this channel. It's about helping others who feel alone with this problem. Your comment could be the one that gives someone hope today. Let's talk now about hydration. This might sound strange, but many seniors with incontinence start drinking less water, thinking it will help them leak less. But this can backfire. When you don't drink enough, your urine becomes concentrated, irritating the bladder and increasing urgency. Not only that, but dehydration increases your risk of urinary tract infections and kidney damage. According to the National Institute on Aging, older adults should aim for about 6 to 8 cups of fluid per day, unless told otherwise by a doctor. The trick is spacing it throughout the day, not drinking a big glass before bed, for example. And avoiding caffeine and alcohol can make a big difference too. One helpful tip, keep a small water bottle with you and sip often. The goal isn't to flood your system, it's to keep your bladder calm and your body hydrated. Do you track how much water you drink each day? Have you ever noticed your symptoms get worse when you're dehydrated? Another often overlooked strategy for bladder health is diet. Certain foods can irritate the bladder and worsen incontinence. Spicy foods, citrus fruits, tomatoes, artificial sweeteners, and carbonated drinks are common triggers. For some people, dairy or gluten may also increase bladder inflammation. A 2019 study published in the journal Urology found that eliminating common bladder irritants led to symptom improvement in over 70% of older adults with overactive bladder. The best way to find your triggers is to keep a bladder diary, a simple log where you write down what you eat, when you leak, and how often you go. Patterns often emerge in just a few days. You can also try the elimination diet, cutting out common irritants for 2 weeks, and then reintroducing them one at a time. Have you ever tried tracking your food alongside your bladder symptoms? What did you notice? Let's take a moment to talk about something extremely empowering: pelvic floor exercises, also known as Kegel exercises. Many seniors have never heard of these, and yet they're one of the most effective non-drug treatments for bladder control. The pelvic floor is a group of muscles that support your bladder, rectum, and in women, the uterus. When these muscles weaken, which happens naturally with age or after childbirth, the support for your bladder becomes weaker. That's when leaks happen. But here's the good news. Like any other muscle, the pelvic floor can be strengthened. A study by the Mayo Clinic found that older women who performed daily Kegels for 12 weeks had a 70% reduction in urinary leakage episodes. Men can benefit too, especially after prostate procedures. The key is consistency. Start by tightening. The muscles you'd use to stop the flow of urine. Hold for 5 seconds, then relax for 5 seconds. Do this 10 to 15 times in a row, 3 times a day. It doesn't require equipment, and you can do it while sitting, lying down, or even standing in line. Have you ever tried Kegel exercises? What kind of improvements have you noticed? Or what's held you back from trying? Let's now dive into bladder training. This is another non-invasive technique that can significantly improve both urge and mixed incontinence. Bladder training involves teaching your bladder to hold urine for longer periods and reconditioning the urge reflex. You start by keeping a log of when you go to the bathroom and when leaks occur. Then, instead of going every time you feel the urge, you delay urination by 5 to 10 minutes, slowly increasing that time to 30 minutes, then an hour. It may feel difficult at first, but over time, your bladder becomes less sensitive and urgency decreases. A Harvard Health study showed that older adults who used bladder training saw a 57% improvement in urgency control within 8 weeks. Pairing. This with Kegel exercises leads to even greater improvement. What's holding your bladder hostage shouldn't be fear, it should be strategy. Have you ever tried delaying your bathroom visits to retrain your bladder? How did it go? There's another approach that many seniors overlook, timed voiding. This method works well for people with memory loss or those who can't feel the urge to go, such as those with advanced diabetes or after a stroke. Timed voiding means you set an alarm or schedule to go to the bathroom every 2 to 4 hours, whether you feel the urge or not. This prevents accidents and keeps your bladder on a reliable routine. Many caregivers of seniors with dementia use this to reduce nighttime accidents or emergencies that lead to falls. It can also give back dignity to seniors who feel embarrassed by constant leaks. One caregiver in Texas said it changed her father's life. Before timed voiding, he was afraid to leave home. After it, he started gardening again and even going to church events with confidence. Have you or a loved one ever tried using a bathroom schedule? Would a simple timer help you gain control again? If this video has helped you so far, please type yes in the comment section. If not, type no. This will help us create more valuable health content that meets your exact needs. Let's take a minute to address a sensitive but important topic, incontinence products. Many people hate using pads or adult briefs because it makes them feel ashamed or old. But the truth is, the right product can give you freedom, not take it away. There are now modern, discreet, comfortable options that don't make noise, don't show underclothes, and don't irritate the skin. Products like absorbent underwear, washable pads, and even reusable bed protectors can offer peace of mind while you work on the long-term fix. The key is finding a product that fits well, absorbs properly, and doesn't cause rashes. Many brands even offer free samples to try before you buy. Don't think of them as permanent solutions. Think of them as helpful tools on your journey to healing. Would you be willing to share which products you found most comfortable or useful? Your experience might help someone who feels lost. Another key factor in healing is your mindset. Incontinence often makes people feel isolated, depressed, or anxious. You start avoiding trips, social events, or even short walks because of the fear of leakage. This kind of avoidance creates a cycle of fear and shrinking independence. But here's the truth, you are not alone. Millions of people deal with this, and many have found help. Talking openly, educating yourself, and connecting with others can lift the burden. One woman from Florida told us she hadn't left her home in 3 months because of incontinence. After learning some of these methods and joining an online support group, she not only stopped using pads daily, she took a cruise with her sister after 2 years. Your body may be aging, but your spirit is not broken. You deserve to live freely and joyfully. What's one thing you miss doing that incontinence has taken from you? We can't ignore the importance of seeing a specialist. Many seniors rely only on their primary care doctor for bladder issues. but a urologist or urogynecologist can offer much deeper insights. They can perform simple tests like a bladder scan, urodynamics, or even cystoscopy to see what's really happening. If necessary, they may recommend medications, bladder Botox, nerve stimulation, or other procedures. Many people suffer needlessly for years when a quick office visit could reveal a treatable cause. Think of it this way. If your knee hurt every time you walked, you'd see an orthopedic doctor. Why not give the same attention to your bladder? When was the last time you saw a specialist about your symptoms? Did they offer any treatment options you hadn't considered? Let's talk about natural remedies and herbs that have shown promising results in supporting bladder health, especially for older adults. One of the most researched is pumpkin seed extract. Clinical studies from Japan and Germany have shown that pumpkin seed oil can significantly reduce both daytime and nighttime urinary frequency in people over 60. It contains compounds that support bladder muscle strength and reduce inflammation in the urinary tract. Seniors who took 10 grams of pumpkin seed extract daily saw a 39% improvement in bladder control in just 6 weeks. Imagine that, improving your life with a food you might already enjoy. Have you ever tried pumpkin seeds or their extract? What changes did you notice in your symptoms? Another powerful natural remedy is corn silk tea. Yes, the silky threads from corn husks that most people throw away actually contain beneficial plant compounds that calm irritated bladders. Corn silk tea has been used in traditional medicine for generations to reduce bladder inflammation, improve urine flow, and even fight infections. It acts as a mild diuretic without causing urgency. Many seniors find it gentler than cranberry juice, which can sometimes worsen bladder irritation. Simply steep a handful of fresh or dried corn silk in hot water, let it sit for 15 minutes, and sip it slowly. Some say it's the best-kept secret for calming overactive bladders. Would you be open to trying something so simple and natural? What other herbal remedies have worked for you? Let's address another critical cause of incontinence that most people never suspect: chronic constipation. When your bowels are backed up, the pressure in your abdomen increases and puts stress on the bladder. This can cause leaking, urgency, and even full accidents. Many seniors take iron supplements or pain medications that worsen constipation. If you haven't had a complete bowel movement in 2 days or feel bloated regularly, your incontinence might actually be coming from your gut, not your bladder. Increasing fiber through fruits like prunes, apples, or figs, staying hydrated, and gentle movement like walking can help resolve this. One gentleman in Arizona said that once he started drinking a glass of warm prune juice every morning, not only did his bowel movements improve, his nighttime accidents nearly stopped. Could your bladder issues be connected to constipation too? Share your experience. We learn more together. Let's pause for a mid-video check-in. If this video has helped you feel more confident or less alone, please hit that like button and leave a thoughtful comment. When you comment, it helps others find this life-changing information, and it could be the reason someone else takes the first step toward healing. Let's be the community that uplifts, supports, and heals together. Now let's look at fluid timing, a powerful yet often overlooked lifestyle change. Many seniors drink large amounts of fluids in the evening and then wake up 2 or 3 times at night to pee. This interrupts sleep, increases the risk of falls, and adds stress to the bladder. The solution isn't drinking less, it's drinking strategically. Hydrate well between 7 a.m. and 5 p.m., then taper off in the evening. Avoid caffeinated drinks like coffee, soda, and tea after 4 p.m., as they act as diuretics. A simple change in timing can improve your sleep and reduce nighttime leakage. One woman from Ohio said that once she moved her water drinking habit to the early hours of the day, she stopped needing to change the sheets every morning. Could changing when you drink be the missing piece for you? Another rarely discussed but important factor is posture and body weight. carrying excess weight in. The abdomen increases pressure on the bladder and pelvic floor. This is especially true for women who've had multiple pregnancies. Even losing just 5% of your body weight can improve bladder control. What's more, slouching when sitting or standing compresses the bladder. Seniors who practice posture correction through light yoga or physical therapy often report better bladder capacity and fewer accidents. Good posture isn't just for back pain, it's part of bladder control. When you sit down, do you ever feel your bladder squish uncomfortably? That's your body telling you it needs better alignment. Let's also discuss smoking. Smoking is a major irritant to the bladder lining, and it also causes chronic coughing. Every cough is like a mini pressure bomb on your pelvic floor. Over time, this weakens the muscles responsible for holding urine in. Quitting smoking improves bladder symptoms in just a few weeks. A large US study found that women over 60 who quit smoking saw a 48% reduction in stress incontinence within 3 months. Men benefit just as much. If you smoke, quitting could be the most important decision for your bladder health. And if you've already quit, share what helped you. It might inspire someone else here in our community. Now let's talk about nerve health, especially if you have diabetes or neuropathy. Nerves play a crucial role in bladder control. When nerves are damaged, your brain may not get the signal that it's time to go, or worse, you may feel an overwhelming urge with no warning. Controlling blood sugar, managing diabetes medications, and adding nutrients like B12 and alpha-lipoic acid can support nerve healing. One man in Michigan with type 2 diabetes reversed his urge incontinence by improving his A1C and taking B vitamin supplements daily. He went from leaking 3 times a day to only once a week. If you have diabetes, do you think nerve damage might be playing a role in your symptoms? Let's not forget about emotional health. Anxiety and stress can tighten pelvic muscles and lead to urgency or frequency. Depression can reduce your motivation to stay active or eat well, both of which affect your bladder. Relaxation techniques, like deep breathing, meditation, or even guided visualization, have been shown to reduce incontinence episodes in seniors by up to 30%, according to a UCLA study. You might think, I've got too much going on for meditation, but even 5 minutes of calm breathing in the morning can reset your system. One of our viewers once said that her breathing exercises felt like letting her bladder breathe, too. What small calming ritual could you start today? And now, before we wrap up, though we're not signaling the end, let's talk about hydration myths. Some people with incontinence drink very little water, thinking it'll prevent leaks. But dehydration concentrates the urine, making it more acidic, which irritates the bladder and makes urgency worse. It also increases the risk of urinary tract infections. The key is balance. Aim for 6 to 8 glasses of water daily, mostly during the earlier part of the day. If your urine is dark yellow or has a strong smell, that's a sign you're dehydrated. If it's pale yellow, you're doing well. Do you find it hard to drink enough water? How do you remind yourself to stay hydrated? Let's finish with something truly hopeful. One of our longtime viewers, Maria, age 74 from Savannah, wrote to us last month. For years, she was afraid to leave home because of accidents. But after watching our past video on bladder health, she started pelvic floor exercises, reduced evening fluids, and saw a urologist for medication. 3 months later, she went on a road trip with her granddaughter, confident and dry. That's the kind of transformation that's possible when we take our health into our own hands and lean on the support of a caring community. This channel, Seniors Health 24, is here to walk with you every step of the way. So let's hear from you. What methods have worked best for your incontinence? Have you found relief through diet, exercises, herbs, or medical treatments? Leave your experience in the comments, not just for us, but for someone else reading, someone who's scared and looking for hope. Together, we're stronger. Together, we heal.